Dr. Yumeng here.
Hello everyone, my name is Yumeng and I'm from the Eye and ENT Hospital of Fudan University in Shanghai. Thanks for giving me the opportunity to present here, and today my topic is changes in aqueous human metabolites and their relationship with post-operative macular edema in NPDR patients undergoing cataract surgery with anti-VEGF treatment. We know that macular edema is a common cause of vision loss after cataract surgery, and in diabetic patients, the risk of developing post-operative macular edema, whether DME or PCME, is both significantly increased. This risk is especially higher in patients with diabetic retinopathy, which is DR, where the incidence of post-operative edema is even greater. For DME, the ETDRS previously used clinically significant macular edema CSME as the threshold for treatment. However, more recently, a classification system developed by drcr.net has become more clinically relevant. According to this classification, DME is now categorized into center-involving DME, which is CIDME, and non-center-involving DME, which is NCIDME. The diagnostic criteria are based on OCT imaging, where CIDME is characterized by the accumulation of intraretinal or subretinal fluid in the center of the macula, along with thickening of the center area with a diameter of 1 millimeter. So this is the DME classification standard published by the drcr.net in JAMA Ophthalmology, which is a little bit of complex, but in summary, NCIDME refers to an increase in retinal thickness outside the central 1 millimeter area without involvement of the center of the macula. On OCT images, fluid accumulation is observed, but the fovea remains normal. However, CIDME refers to an increase in retinal thickness within the central 1 millimeter area, with OCT images showing significant fluid accumulation in the fovea area, usually accompanied by vision loss. And studies have shown that in patients with NCIDME, the risk of developing CIDME after cataract surgery is significantly increased. And patients with a history of DME treatment have a higher risk of developing into CIDME after cataract surgery compared to those without a history of DME. Therefore, taking preventive measures against macular edema is particularly crucial for the visual recovery of patients with non-CIDME. And currently, anti-VEGF is a first-line therapy for center involving DME and is also applicable to cataract patients with CIDME. However, there is still a debate in clinical practice regarding whether post-operative anti-VEGF treatment is needed for cataract patients without pre-operative CIDME to prevent the development into CIDME. And some researchers have already reported that injecting anti-VEGF drugs after phaco immediately in eyes with DME can prevent the worsening of macular edema. And numerous RCT have shown that post-operative anti-VEGF treatment can significantly reduce the incidence of DME after cataract surgery. And next, I'm going to introduce our research. So our study basically aims to explore the effect of combined cataract surgery and conbercept on the short-term occurrence and development of CIDME after cataract surgery in patients both with cataracts, NPDR, and NCIDME, and also investigating the changes in aqueous human metabolites before and after cataract surgery, aiming to evaluate their correlation with pharmacokinetics and clinical prognosis. This is our inclusion criteria, so we focus on the cataract patients both have NPDR and NCIDME. This is our exclusion criteria. And our study is the RCT. The patients were randomly divided into the treatment group, which combines the cataract surgery and anti-VEGF treatment, and the control group conduct cataract surgery only. Aqueous human samples were collected during and 1 week after surgery, and ophthalmology examinations were performed 1 week till 3 months after surgery. Metabolites in aqueous human were analyzed using high throughput targeted metabolomics techniques, and prognostic analysis were performed in combination with machine learning strategy. This is our preliminary result. We use both unidimensional and multidimensional statistic analysis. This is the PCA result, and this is OPLSDA analysis. And we can find that there are changes of aqueous human metabolites in both two groups, but the control groups remains relatively stable pre and after operation. And this is a Venn diagram of differential metabolites screened by uni and multi-dimensional statistics. And we also found there are two common differences in metabolites between these two groups. Next, we have conduct pathway-associated metabolites enrichment analysis, and this is a result for the control group before and after surgery. And this is the result for the treatment group. However, there are no significant difference in post-operative BCV and CST between these two groups. In this case, we decide to re-divide our patients based on their prognosis result, mainly based on their CRT change before and after 3 months of surgery. And this is an example of good prognosis group, and this is a poor prognosis group. And we also found that there are several changes of aqueous human metabolites before and after surgery according to different prognosis group. So good prognosis group BCV and CS better, and also some of the metabolites change significantly in aqueous human compared with these two different groups, which makes us think whether some of them metabolites have predictive meaning. So we have conduct several machine learning strategy, which are random forest, support vector machine, and brutal analysis. And surprisingly, there are 4 metabolites in common with these 3 machine learning strategy. So these 4 metabolites can be the marker for the predictive meaning. And we also conduct logistic regression model to predict the ROC curve and PR curve. And finally, we have conducted correlation analysis of aqueous human metabolites and systematic indicators. The mediating effects of blood markers, differential metabolites, and prognostic outcomes were calculated. And we do have found some of the blood indicators are really relevant with prognostic outcomes. So in conclusion, we found in diabetic patients, age metabolite levels after cataract surgery remain relatively stable. However, the intraoperative injection of anti-VEGF drugs during the surgery can alter the aqueous human metabolites profile, and differential metabolites are mainly related to these 3 pathways. And changes in metabolites levels are correlated with prognosis, and some metabolites reflect the mediating effect of systematic blood indicators on prognosis. And for patients who may experience worsening macular edema after cataract surgery, we suggest adopt personalized preventive measures such as anti-VEGF treatment. So thank you.
Thank you.